Recognize the Deputy Leader of the Opposition.
Mr. Speaker, we're joined today by Dr. Alexandra Carter, a neurologist and epileptologist, along with Kim Ebert and her son, Cody Holgate. They are here because this tired and out-of-touch Sask Party government halted negotiations to publicly fund a life-saving anti-seizure medication, Xcopri. Mr. Speaker, 1/3 of epilepsy patients have a drug-resistant form of epilepsy. Xcopri is said to fill those gaps and provide relief for thousands in Saskatchewan alone. Why did Saskatchewan halt negotiations on this life-changing and life-saving medication?
Recognize the Premier.
Here. Thank you. Mr. Speaker, and I would first welcome Alexander, Kim and Cody to their Legislative Assembly here today. Saskatchewan's not halting negotiations in any way, Mr. Speaker. In this province, we have a formula and a Saskatchewan drug plan, which is the most comprehensive, has some of the most comprehensive, if not the most comprehensive coverage in the nation of Canada. The process that a drug will find its way through to approval and ultimately to that, to our provincial formulary and drug plan, Mr. Speaker, is to be approved by the Canada Drug Agency. Mr. Speaker, my understanding is that has happened. And then the provinces will come together at the stage of the Pan-Canadian Pharmaceutical Alliance, Mr. Speaker. It is at this stage. I understand that there are some breakdown in the negotiations. What I have asked our Provincial Minister of Health to do and the Ministry of Health to do, Mr. Speaker, is to reach out to his colleagues across the nation to see if there's any way to restart, to reinvigorate those discussions immediately, Mr. Speaker, and if not, is there a way for Saskatchewan to re-engage, Mr. Speaker, to make this also important drug available to Saskatchewan families and Saskatchewan people that require it.
Recognize the Deputy Leader of the Opposition.
Let's be clear, Mr. Speaker, Saskatchewan has walked away from the negotiating table. Patients that live with uncontrolled seizures live with the unknown every single day. This disease impacts all areas of their life, from work to education to social relationships to mental health. And there is a medication that can change the lives of thousands of people in this province. Yet this government has pulled out of negotiations that would see this medication publicly funded. Will the minister take leadership? Will he work with other provincial leaders and get back to the negotiating table?
Recognize the Minister of Health.
Thank you, Mr. Speaker, and thank you to the member opposite for the question. I, too, would like to welcome Dr. Carter and Kim and Cody to their legislature as they advocate on behalf of Cody and certainly though many people living with epilepsy here in Saskatchewan. As the Premier mentioned, his first answer, unfortunately, negotiations did break down between all provinces and the Pan-Canadian Pharmaceutical Alliance last month. As the Premier said in his last answer, he's directed me and I've directed the Ministry of Health to work directly with other provinces to try and open those negotiations with the Pan-Canadian Pharmaceutical Alliance. If those don't open, we'll try and work directly with the drug provider, again, to make this drug available to people like Cody and many others who need it here in Saskatchewan. Thank you, Mr. Speaker.
Recognize the Deputy Leader of the Opposition.
Mr. Speaker, people are waiting for access to this treatment, having seizures that have so many consequences in their life, Mr. Speaker, while they're waiting for this government to take action. The Canadian Drug Agency, which Saskatchewan funds, recommended that Xcopri be publicly funded. It was approved by Health Canada in 2023. The cost is aligned with other similarly publicly funded medication. And we know that having access to this medication will improve the lives of thousands of patients in Saskatchewan. Now, Saskatchewan has led in healthcare before. Will the minister commit to taking on that leadership in healthcare again?
Recognize the Minister of Health.
Thank you, Mr. Speaker. Mr. Speaker, I will do exactly that. That's exactly what I've committed to doing. And you know, Mr. Speaker, those of us in this chamber, many of us have friends or family members that live with epilepsy here in this province, Mr. Speaker, and that's exactly why we will take that leadership role. Thank you.
Recognize the Deputy Leader of the Opposition.
Mr. Speaker, what the minister is failing to talk about is why he walked away from the deal in the first place. They should be at that table. They should have come to this agreement. They should have made this drug publicly available for people in the first place. We shouldn't have to have people coming to the legislature to make this happen here today. Hear, hear. Mr. Speaker, people should be able to have access to health care when and where they need it. And for many epilepsy patients in Saskatchewan, Xcopri is the right drug to treat their condition. Dr. Carter and this family have come here today to have their voices heard. What does the Minister of Health have to say to these families who have to go without treatment they need because this government walked away from the negotiating table? Hear, hear. Hear.
Recognize the Minister of Health.
Mr. Speaker, the wording of the question from the member opposite shows not sure that she has an understanding of how the process of a drug is added to the Saskatchewan formulary, Mr. Speaker. Mr. Speaker, in this province, we have one of the most comprehensive drug plans in all of the country, Mr. Speaker. The member from Saskatoon Fairview, I'd appreciate the opportunity to finish my answer to this question, right. Mr. Speaker. Mr. Speaker, as I said, we invest close to $400 million a year into our Saskatchewan drug plan, Mr. Speaker. This is because there's a process that we follow. This is because we work with people, with families that come forward, with members of the opposition, with people in this province, healthcare providers that bring forward opportunities to add new drugs to the formulary, Mr. Speaker. There is a process, as I've committed in my previous answers, and I'm doing again right now, Mr. Speaker. We're going to work to make sure that Xcopri can be available to Saskatchewan residents who need it. Thank you.
Yeah. Recognize the member from Regina Walsh Acres.
Thank you, Mr. Speaker. One of the families with us today are my constituents, Cody and Kim. Cody has had an uncontrollable seizure disorder his whole life. In 2021, he started having drop seizures, which would happen unexpectedly, and he would fall forward or backwards, stiff and unconscious, up to 5 or 6 times a week. Before Xcopri was approved in Canada, he and his family traveled to New York once a month for 9 months, paying out of pocket just to access this medication. What does the minister say to patients and families like Cody's who deserve publicly funded access to this medication? And will he agree to meet with Cody, Kim, and Dr. Carter today?
Yeah. Recognize the Minister of Health.
Thank you, Mr. Speaker. Mr. Speaker, as I said previously, many members in this Assembly are close personal friends or family members of those who live with epilepsy here in our province, Mr. Speaker. We understand the incredible family sacrifices that are made to support family members living with this condition, Mr. Speaker. I'd be happy to meet with Kim and Cody and Dr. Carter, Mr. Speaker. I also have an official from the Ministry of Health here in the building, actually, who is our representative on the Pan-Canadian Pharmaceutical Alliance, and who can provide more of a comprehensive update on exactly where we're at with Xcopri, Mr. Speaker, as I've committed to, Mr. Speaker. And I assure the member from Regina Walsh Acres, I'm going to be working hard with the Ministry of Health officials to make sure, again, that we can make Xcopri available to people like Cody and those in the province who need it. Thank you.
Hear, hear. Recognize the member from Regina Walsh Acres.
Thank you, Mr. Speaker. Cody would suffer multiple concussions per week, cuts, bumps, and bruises from these uncontrollable drop seizures. His mom explains that his brain couldn't sustain any more trauma. That was until they traveled to New York and were able to access Xcopri, a drug that they believe saved his life and could save many others. When can the family expect to have access to Xcopri?
Recognize the Minister of Health.
Thank you, Mr. Speaker. Mr. Speaker, I look forward to sitting down with Cody and Kim and Dr. Carter later today to talk exactly about how we enter into that process. Thank you.